This segment of Delmarva Life is brought to you by TidalHealth.
All right, picture this. It's a Sunday night. You or somebody in the family suddenly gets ill. You really don't think it's serious, but you do want to see a doctor.
Yeah, and obviously your primary care physician is unavailable on a Sunday night. So should you head to the emergency room? Well, maybe not. Joining us today with some guidance on this issue is Dr. Jim Trumbull, Vice President of Clinical Integration for TidalHealth. Thanks for joining us this afternoon. So why is this such an important topic right now?
So obviously we're still in the throes of the most recent COVID surge that we have. And although we're seeing some gentle improvement here, I'll describe it, it's still a significant strain on the system, not just for TidalHealth, but across the country and for our region as well. Volumes are still very high, but just as important, the severity of those patients who are sick is very high as well. And it really does strain the capacity, on top of which, like any other business out there, we have our fair share of patients who are ill. Now, fortunately, our team has really stepped up to really fill in for those needs to serve our community. But, you know, at the same time, we need our community to be thoughtful about how they're using those services as well.
Sure.
Okay, so with that thought in mind, how would you define an actual emergency?
So I think many of us think about emergencies in terms of, am I having a heart attack? Is this a bad car accident? Things of that nature. And what you have to remember is that the emergency is really an interpretation from the patient's side, right? So am I having chest pain? Those are that kind of thing. Am I severely short of breath? Concerns of stroke? Those are the things you want to think about. If you're having those kind of symptoms and others like them, that you're thinking this might be an emergency, yes, that is the time that you want to use the emergency department.
Sniffle doesn't count.
No, that's really something where you really want to give a call to your primary care doctor, or if they're not available, as you mentioned in the beginning, think about an urgent care.
Yeah, so let's talk a little bit about when we should be calling that our primary care physician.
Sure. So it's certainly what I try to tell patients, and including those that I see, that if it's an existing problem, something that we've talked about in the past, that's a perfect time to call your doctor, because they're going to know you better than anybody else. And if there's subtle changes that can be made to help you stay at home and recover there, all the better. But if they're not available after hours, certainly urgent cares in the area, such as your doc's in, that we have a partnership with, as well as immediate cares that we have up in Laurel and Seaford, are available as well.
So if it's not an emergency and the urgent cares are not open on a Sunday night, you probably can just wait until Monday morning to give a call?
Well, certainly, if you're thinking it's something minor, something non-life-threatening, that's certainly one option. But keep in mind, just about every office that's out there for primary care, they have a provider on call. So if you have an established physician, you can call that telephone line, and there is mechanisms for to get in touch with that on-call doctor. So not only could they potentially make arrangements for you the next day, but they can advise you as well. If after talking to them, they think this is something that you should go to the emergency department for, then that's a call worth having. But in many cases, they'll tell you that this is something we can treat you or see you for the next day, or to go to an urgent care.
Okay.
Perfect.
Good information, especially this time of year, or this with what's going on. Yeah. Dr. James Trumbull with TidalHealth, thank you.
Thank you.